Hello everyone. Today we're going to start with a new new session, you can say. That is, today we'll discuss about sedative and hypnotics. It's from pharmacology subject. And now I'm going to share my screen. You can see from here. That's all. So we can start sedatives and hypnotics. About sedatives and hypnotics. So first of all, here I will include this topic for definition of sedative and hypnotics, pharmacological classification of sedative and hypnotics, difference between sedatives and hypnotics, pharmacology of barbiturate and pharmacology of benzodiazepine. Mostly I will try to discuss here one specific topic, that is definition, then classification, and then pharmacology of barbiturate and benzodiazepine. Benzodiazepine. This is one of the important topic. Next, here you can next slide. Next, definition of sedatives. Sedatives are prescribed by doctors, and these sedatives also used for the treatment of anxiety and sleep disorder. Next, about hypnotics. Hypnosis. So hypnosis means sleeping, and hypnotics also known as sleeping pill. You see, also known as sleeping pill. And then hypnotics used for the treatment of insomnia, or it is used for inducing of sleep. Next, you have to know the difference between sedatives and hypnotics. Main difference is sedatives are the drugs which reduces excitement, or you can say CNS depressant. And hypnotics are the sleeping pill. Hypnotics are used for inducing sleep as normal sleep. And also if you increase the dose of sedatives, then it may leads to hypnosis. And if you increase the dose of hypnotics, it may lead to general anesthesia. And these sedatives acts on limbic system and hypnotics acts on midbrain. These are the main difference between the hypnotics and sedatives. Here you see dose response curve for two hypothetical sedative hypnotic drug. Here two drug is there. One is drug A, another is drug B. From this graph you can see drug A and drug B. If you increase the dose of drug A, here this side you can see sedation, hypnosis, anesthesia. That means if you increase the dose of drug A, first of all it will leads to sedation, then hypnosis, then it may leads to anesthesia. If you increase more, then it may leads to coma and death also. And in case of drug B, you can see here, if you are increasing dose of the drug, first of all it gives the sedation, then it gives hypnosis, then it depresses CNS. So drug A example may be barbiturate, alcohol, and drug B example is benzodiazepine. Then you have to know now you have to know about the barbiturates, and here you have to know the pharmacology of barbiturates. For that you have to know definition, pharmacological classification, mechanism of action, and pharmacokinetics, pharmacological uses, adverse effect, and drug interaction. These things you have to know. It is very very important. In case of barbiturate also you have to know this thing. So next you have to know about a definition of barbiturate, and this you have to know barbiturate is substituted derivative of barbituric acid, and it have both sedative and hypnotic activity. Then you have to know the pharmacological classification of barbiturate, this one, and this is important. You have to remember this. In MCQs also this may ask, means what is the long acting barbiturate and what is the specific function of that, what is ultra short acting barbiturate, and this function of ultra short acting barbiturate. So in long acting barbiturate you can see the phenobarbital and ultra short acting thiopental. Phenobarbital is used for epilepsy and thiopental used as anesthesia. And then you have to know this, the dose dependent action barbiturate. What are the dose dependent action of barbiturate? In normal dose it may give sedative activity, but in if you increase the dose it may leads to hypnotic activity, and again if you are increasing dose it will leads to anesthesia, and if you are continuously using the dose from anesthesia it may cause coma and it may leads to the death of the patient. So you have to give concentration on dose. Again you have to know this is the actions, means at lower dose it produce sedation, at higher dose it may cause hypnosis, then it may cause anesthesia, then coma and death. This is the pharmacological action of barbiturate. Again mechanism of action, it is important for barbiturate and benzodiazepine. A mechanism of action is same for both. You can see barbiturate and benzodiazepine binding site is same, that is GABA A receptor. In GABA you will get the subunit like alpha, beta, gamma, and both the barbiturate and benzodiazepine will binds to the GABA GABA A alpha receptor, and it will leads to sedation. In benzodiazepine, you can see benzodiazepine binds with the GABA A receptor and it opens the chloride channel. It may lead to hyperpolarization. This may lead sedatives and benzodiazepine also. But both the benzodiazepine and barbiturate binds with the allosteric site. Here, one thing is important. This antagonism. You have to remember these three drugs: bicuculin, flumazenil, picrotoxin. Bicuculin antagonists at GABA receptor competitively. Remember this term, GABA receptor. Flumazenil is the competitive antagonist of benzodiazepine. Remember this. And picrotoxin also block chloride channels non-competitively. These three is important. In maximum MCQs, you will get questions from this. And again, you have to know the pharmacokinetics. The pharmacokinetics, that means you have to know absorption, distribution, metabolism, and excretion procedure. That means in here, both the benzodiazepine and barbiturate have good uh, absorption orally, well absorbed from means orally, and it have more lipid solubility. That means if lipid solubility is increased, that means the potency of drug will be increased, but the half-life of the drug will be decreased. Remember this thing. And after that, you have to know the uses of barbiturate. If you know the classification, you can write the uses of barbiturate. Therapeutic uses of barbiturate. The barbiturate may be used as sedative hypnotics. Barbiturate is used as anesthesia like thiopental. Barbiturate may used as anticonvulsant. Example is phenobarbital. Then you have to know the adverse effect of barbiturate, that are hypotension, drowsiness, lethargy, vertigo, respiratory depression, headache, nausea, sedation, skin rash. This is all about barbiturate. Now you have to know about diazepam, benzodiazepine, and same thing you have to know like barbiturate, that are definition, pharmacological classification, mechanism of action, pharmacokinetic, pharmacological uses, adverse effects, and drug interaction. This is the main classification of drug. Already I have said, if you know the classification of drug, pharmacological classification of drug, you can write the uses. And you have to know this class. This is important slide. And some drugs have hypnotic activity, and some drugs have anti-anxiety activity, anticonvulsant activity. In uses, you can write the benzodiazepine have sedative hypnotic activity. That are example is diazepam, flurazepam. And again, second uses, that is benzodiazepine have anti-anxiety activity. That are example is diazepam, oxazepam. And third, you can write benzodiazepine have anticonvulsant activity. You can write the example also. Here it is also important. The short-acting benzodiazepam, long-acting benzodiazepam, and intermediate-acting benzodiazepam. These all. And this is the GABA receptor. Already I have said GABA receptor have three subunit, mainly alpha, beta, and gamma. But both the this alpha 1, there are 6 different alpha subunits: alpha 1, alpha 2, 2 alpha 1, 2 alpha 2, 2 alpha 3, like that. But alpha 1 receptor, alpha 1 side of the GABA receptor is responsible for inducing sleep, and alpha 2 and alpha 3 subunit of GABA receptors are responsible for anxiety. That means you can say that alpha 1 subunit, zolpidem and zolpidem are the drugs which bind with the alpha 1 subunits, and this leads to induced sleep. And pharmacokinetics, you have to know this alpha barbiturate and benzodiazepine have good lipophilic activity, so rapidly it is metabolized in your body, but it have good absorption through orally. And after that, you have to know pharmacological actions of barbiturate, that a reduction of anxiety. From classification of drug, you can write. So it have sedative hypnotic activity, it have anticonvulsant activity. Benzodiazepine also have muscle relaxant activity. Shortly, I have written here uses of benzodiazepine. Benzodiazepine are used for anxiety disorder, insomnia, acute status epilepticus, induction of amnesia, spastic disorder, seizure disorder, and agitation. For this, benzodiazepine is used. So after that, these are the benzodiazepine adverse effect like sedation, lethargy, dependency withdrawal effect, respiratory depression, and cognitive impairment. Thank you so much. So this is one of the important topic like sedative and hypnotics and classification of sedative and hypnotics. And you have to remember the pharmacology of sedatives, uh, pharmacology of barbiturate and benzodiazepine. So thank you so much. Again, I will come with new topic. Thank you.